Age-related macular degeneration, or AMD, is a sight-threatening condition that affects your retina, which is a light-sensitive tissue lining the back wall inside the eye, analogous to the film in a camera. In macular degeneration, the macula, or the central part of the retina, becomes damaged. The macula is the part of the eye that serves your central, high-resolution vision, such as reading or recognizing people's faces. Unfortunately, AMD is a leading cause of central vision loss in older persons. There are two types of macular degeneration: dry and wet AMD. Patients may initially start with dry AMD, which in the early stages may be asymptomatic, and then they may progress on to develop wet AMD. In dry or atrophic AMD, there is wear and tear of the macula due to aging changes, and the macula gets thinner with age, and tiny clumps of debris called Drusen accumulate. Slowly progressive and insidious loss of central vision occurs with dry AMD. This is the most common type of macular degeneration, accounting for about 90% of all cases. Unfortunately, there is currently no way to treat dry AMD, but there is a lot of medical research into developing one. Wet AMD is a less common but more aggressive form of macular degeneration, and this is very much treatable if detected early. Wet AMD is characterized by the development of new abnormal blood vessels that grow under the macula. These blood vessels are fragile and consequently bleed easily, causing swelling of the macula. Wet AMD can present more acutely with recent onset of wavy, crooked or blurry central vision. Modern medical treatment for wet AMD, offered by our doctors at Eastwood Eye Specialists, is highly effective and successful in protecting vision. Risk factors for getting macular degeneration include age over 50 years, a family history of AMD, and cigarette smoking. With early AMD, there are often no symptoms, and so many people don't realize that they have AMD until their vision becomes very blurry. This is why it is important to have regular visits to an eye care professional, especially for those aged over 50 years. Using high magnification ocular microscopes and specialized retinal imaging tests such as 3D OCT scans and angiogram, we have the latest technology and expertise here at Eastwood Eye Specialists to diagnose and treat macular degeneration. Treatment for AMD is tailored to each individual depending on the grade or severity of their macular degeneration. All patients benefit from a healthy diet rich in fresh vegetables, fish, and nuts. Some patients may benefit from macular vitamin supplements, whilst others will not. Wet AMD requires prompt diagnosis and early treatment. Delay in treatment may result in severe vision loss. The main class of medications used to treat wet AMD are called anti-VEGF injections, and the currently available ones in Australia are Lucentis, Eylea, Beovu, and Avastin. These medications can only be delivered into the eye by an intravitreal injection using very tiny needle. If this is recommended, further detailed information may be provided, but you can be sure that necessary treatment will be provided in the most safe, effective, and comfortable manner by our retina subspecialty trained eye doctor. This video is not medical advice, but has been designed to serve as supplemental educational material only. Further tailored discussion will take place with your eye specialist. Every person's eyes and specific diagnosis are unique. Tailored advice will be provided to each patient by their eye doctor at Eastwood Eye Specialists.